Around the nation this weekend, conspiracy theorist Alex Jones has asked a Connecticut judge to throw out a $965 million verdict against him. He's also asking that a new trial be heard in his lawsuit by the Sandy Hook families. His motion claims pretrial rulings were unfair and a, quote, substantial miscarriage of justice, also saying the compensatory damages by the jury were excessive. A lawyer for the 15 plaintiffs says his clients will submit a brief opposing Jones's request. And Jones was sued by Sandy Hook families who claimed that he subjected them to harassment after threats, and saying that he told his followers that he made claims that the shooting was a hoax and he wanted to push more gun control laws. CDC Director Dr. Rochelle Walensky tested positive for COVID-19 on Friday. Walensky up to date on her vaccinations and says she has mild symptoms. The agency says Walensky is isolating at home and is going to work virtually. Walensky took over the CDC in January of 2021 after being appointed by President Biden, and she's the latest U.S. health official to test positive for COVID. We have more COVID news tonight. Pfizer announcing that they have plans to start selling COVID vaccines. They expect the government will stop paying for it. The vaccines would be sold for $110 to $130 per dose. However, people with insurance would likely only pay a fraction of that cost and maybe even nothing at all. Since the start of the pandemic, the government has provided Americans with free tests, vaccines, and treatment through government programs. Hospitals across the country are sounding the alarm this weekend. They're telling ABC News about a rise of pediatric cases of RSV, the flu, and other respiratory viruses. Returning to Monica Sarabdi with the latest.
Across the country, doctors say they are seeing a rise in pediatric patients with cases of RSV, or respiratory syncytial virus, the flu, and other respiratory viruses. According to the CDC, the age group currently most impacted by the flu-like illness is children under 5.
Not only are we seeing more viruses, we are seeing them sooner than we typically see them in cold and flu season.
Health officials say as people continue to pull back on COVID measures, such as wearing masks and social distancing, we're seeing a surge of infections that in the past might have been spread out over a period of time.
So as we get into the flu season, you might have a convergence of 3 significant respiratory illnesses at one time in children. RSV, which you just mentioned, influenza, and of course there's always the concern as we get into the winter about a surge of a new variant of COVID-19.
Warning signs of respiratory illnesses include fast or labored breathing, flared nostrils, blue or discolored skin on the face, signaling low oxygen, and dehydration, such as dry mouth or a decrease in wet diapers. Hospitals in at least 43 states telling ABC News they are facing a crush of the flu, RSV, and other common viruses.
This is the pediatric version of the beginning of the pandemic, and it has really taxed all of us.
Lakin Weaver lives outside Dallas. She says 3 nearby hospitals were full when her son, who has asthma, came down with RSV.
I'm panicking, crying. That's a scary feeling. You don't know what's happening in that moment.
He was taken to Cook Children's Hospital in Fort Worth, where doctors are treating nearly 300 RSV patients a day.
This has been the highest volume of patients I have ever seen.
Health officials say they are preparing for a possible shortage of beds for the most vulnerable. Monica Sarabdi, ABC News, New York.